Hi, this is Dr. Tony Jabbour. I'd like to welcome you to our Union Pines Surgery Center. I want to assure you that you will be greatly taken care of while you're here at Union Pines Surgery Center, before, during, and after your knee replacement. You are definitely going to get personalized care. After your surgery, you will go to the recovery room, and from there, you will go to the extended care unit. You will get great care there.
I'm Dr. Jennifer Peterson. I'm with Tulsa Bone Joint. If you come into one of our clinics and talk to one of our knee surgeons and we decide that a knee replacement is what we're going to go forward with, there are a couple different things you need to know. We will need to make sure that you are medically safe to have surgery, and this will include things like high blood pressure, diabetes, a risk of blood clots, pulmonary issues, or any other condition that might make you a high risk for surgery. So we're going to try to delve into your medical history, make sure that you're safe to undergo surgery, and then if we have any concerns, we may ask that you get primary care clearance or see a cardiologist prior to surgery. One of the big things that we have found that can be an issue with surgery is diabetes. So if you do have a history of diabetes, we will check that before the time of your operation. Most specifically, we'll be getting a hemoglobin A1C value. If this value is above 8, this will likely need to delay surgery. The reason this is because it drastically increases your risk of infection after surgery. So if we find that your hemoglobin A1C is above 8, we will direct you back to your primary care doctor to try to get this under better control. Unfortunately, sometimes this takes about 2 to 3 months. Please note that each surgeon may have slightly different protocol, but this should give you a general idea of what to expect.
Hi, I'm Dr. Scott Reed with Tulsa Bone Joint. First, let me thank you for choosing our team to care for your orthopedic needs. This video will give you a little bit of an insight into what to expect on the day of your total joint surgery. Please keep in mind that each surgeon will have specific protocols that they follow, so your surgeon may differ from this suggestion slightly. On the day of your surgery, it's important that you arrive slightly earlier than you're told. There are many things that you need to get done in order to be able to get to your surgery, and also make sure that we're not keeping others waiting after you. It's important to bring all of the medications that we prescribe to you before your surgery. Keep them in a plastic bag. You don't want to take these medications before your surgery. You're going to want to make sure that you have them available for afterwards. Primary knee replacement generally takes about an hour to an hour and a half, depending on the nature of your knee arthritis and any special circumstances that may exist. You can expect to transition from the operating room into the PACU, where you'll be there for about an hour, perhaps a little bit longer. Then we can transition you to the extended care unit, and in some circumstances, some patients will go to the hotel after that. On the day of surgery, our goal is to get you up and walking. Most people can achieve this the night of surgery. Some patients it takes a little bit longer. Our ultimate goals for you to be able to discharge from the surgery center are that you're medically safe, and this is first and foremost. This includes things like blood pressure, dizziness, nausea, being able to void, etc. Secondarily, we want to make sure that you pass the physical therapy assessment. Again, this includes things like getting up to a chair, getting in and out of the bathroom, getting to the kitchen. And third, we want to make sure that your pain is reasonably controlled with oral pain medication. And this is variable for everyone, but we'll make sure that we do it in a safe manner. Once you've satisfied all of the discharge criteria, you should be able to go home. For patient convenience, some of our patients will discharge to the hotel at Union Pines, which is staffed by home healthcare nurses. I hope this short video gives you a glimpse into what to expect on the day of your total joint surgery. We look forward to caring for your needs.
Hi, I'm Dr. Marcy Clements with Tulsa Bone Joint Associates. On behalf of the entire Total Joint team at Tulsa Bone Joint, I want to thank you for allowing us to take care of you and your knee arthritis. This video serves as an overview of what you might expect during your time at Union Pines Surgery Center Extended Care Unit and Hotel. Various surgeons may have different protocols than what are expressed in this video, so be sure to consult with your individual surgeon before you have your surgery and make sure you clear up any questions, but this will serve as a general overview of what to expect. After your surgery, you will have a large dressing on your knee. This dressing will be changed before you go home to one that is waterproof, which will allow you to shower. You might also notice a small black bag that has a ball in it with numbing medicine in it going through a catheter that goes to your thigh. This device is to help with pain control after surgery. The catheter is sitting right next to a nerve that goes to the front of your knee. So you should experience a significant amount of pain relief on the front of your knee, but it's very normal to still have some pain or discomfort behind your knee. For pain control, after surgery, you will be prescribed narcotics such as oxycodone. Other pain medications that may be prescribed are Tylenol and gabapentin. For nausea, you may be prescribed an antiemetic such as Phenergan or Zofran. You might also be prescribed a muscle relaxer such as Robaxin. Aspirin or a prescription anticoagulant will likely be prescribed as well to prevent blood clots, and those will be utilized only after surgery. Men may also be prescribed a medication called Flomax, which will help with urination postoperatively.
Hi, I'm Dr. Dunitz, and I'm one of the surgeons at Tulsa Bone Joint. You know, every doctor is a little different, and they may have their own protocol, and they may have their own routines, so you really need to discuss all these issues with your physician prior to your surgery, and then even before you go home. But in general, what you're going to find is that when you first go home, you'll probably be fairly comfortable, to tell you the truth. We use a lot of different pain blocks around the time of surgery. We treat you with certain medicines before and after surgery to try to control the pain. Pain often gets worse in the first 48 to 72 hours after surgery. Not uncommon to have increasing pain and discomfort. That's not a reason to be overly concerned unless the pain is so severe it's not controlled with your pain medicine. And then certainly we'll be happy to talk to you, and you can give us a call if it gets to that point. The other thing that we want to remind you is that we like you to get up occasionally. This is to hopefully prevent blood clots. Lying in bed all the time increases the risk of blood clots, and we have to worry about. Another thing that we often use to help to control the pain and swelling is ice. You may go home with a machine that circulates ice over the dressing and the leg, or you may have an ice pack that we utilize and try to control the pain. A little bit individualized by the surgeon. You very likely will go home with either crutches or walker to help support. We believe that's important to use certainly in the first few days after surgery. Those can be advanced to a cane or maybe even nothing, but that needs to be a decision that's made with your therapist and with your physician when the timing is right to get rid of those walking aids. Another thing that often is important to think about is the pain medicines you're going to be taking. They can result in constipation, and sometimes you will be taking stool softeners or other laxatives to try to prevent that. Finally, the dressing is something that is kind of a surgeon-dependent type thing. Lots of surgeons use different dressings. Some of them may have a dressing on for just 2 or 3 days, in which time after that you can bathe or shower, not submerge it, but bathe and shower. Other doctors may use a dressing that's be on from anywhere from 3 days to even 7 days before you remove that dressing. Home therapy and home physical therapist will help with that decision and will help with the dressing changes when needed. I think you'll enjoy your stay at the surgery center and at the hotel. There's lots of things to think about, but in general, we hope everyone does well and can get up and get back into life as quickly as possible as we move you forward. Thank you.